Welcome back. As part of World Mental Health Day activities, first-year students from the University of Namibia plan to host a talent show to raise awareness, particularly for those who are visually impaired. Dana Samukwelele, a lecturer at the University of Namibia in the Psychology and Social Work Department, who also spearheads the initiative, now joins with more detail. Good evening and welcome.
Good evening, and thank you for having me.
Thank you so much for being here. Talk to us about how this talent show and awareness raising initiative started and what inspired it.
Okay. All right. So as part of the first year social work students curriculum, they are supposed to have field practice within any organization chosen by our social work and psychology department. So we have a project called the Big Brother, Big Sister project. So this year we assigned the children, the students to work at the visually impaired school, where they assigned individual children to mentor in terms of any area of their need. It can be career, it can be with their school, it can be with navigating around their identity and self-esteem. So they've been working with the learners at their school from July and just finalized their project on the 9th of October. So just to strengthen the issues that were coming out and the solutions that the students were working on with the learners, we thought, because most of the issues were mental health related issues, issues of self-esteem, issues of self-confidence, issues of bullying. So we thought for us to strengthen what the students have done already with the learners and also to expand it to other learners, because we only worked with 43 learners. So let's have a talent show in commemoration of mental health, which is going to help and give a platform for these learners to just showcase their talents. Most of them have talents, but they don't have opportunities. Yeah.
That's fantastic. It's clear, of course, that this project is addressing, a critical need. Could you explain the specific challenges that the visually impaired children, are facing?
Okay. So number one, because of the state of visual impairment, some of them are totally blind, fully blind. Some of them are partially blind. So some of them were born like that. Some of them just happened along the way. So there's a lot of adaptation and adjustment issues that they go through. Some of them accept, but some of them they go through issues of acceptance, where they struggle to accept. Then we have, that also comes with the issues of self-esteem and self-confidence, because they struggle to present themselves before people, they struggle to present themselves in class when they're trying to navigate how they can now adapt to the new way of learning, new way of socializing. So some of them withdraw totally because they fail to accept, they withdraw totally. Then it's issues of stress comes in, depression, anxiety. And also when I speak of adaptation and adjustment, when you look at the school for the visually impaired, we don't have a lot of these schools in our country. So students are coming from, learners are coming from far places like Zambezi region, they're coming from Oshana region, or Shakati, all the way away from their families of origin and communities of origin. So they have to adapt, create.
That alone is an adjustment on its own.
Yes, so it's a lot of adjustment issues. And also because there's a lack of social workers, we don't have school social workers. So it takes time for them to find somebody to speak to about these issues that they go through, such that sometimes they it ends up in suicidal ideations. Yeah, because it takes quite long for even the teachers to realize what the learners are going through. Yes, so those are just some of them, apart from the bullying and the self-esteem issues I spoke about. And also there's the child protection issues, child abuse issues, because of their children and they're vulnerable already, and then with the visual impairments makes them more vulnerable, and then they are susceptible to abuse.
I want to talk about and hear more about the talents and skills of the visually impaired children.
Yes. It's so amazing when the students were working with these learners and they were talking about their talents. Some of them were even singing to the students. So it was so amazing to read these reports, such that when we came up with this, we were thinking of what can we do. But then when we were thinking about their talents and also emphasizing the work that the students were working with them, it was just the right platform. Because we have learners who are very talented in music, We have learners who are talented in dancing, so on that day they'll be dancing, they'll be singing, they are going to be doing drama, some of them are modeling, and some of them are doing speech. Like they've become so confident such that they just want to speak to other learners.
Yeah, yeah. Through this initiative, how do you plan on, encouraging understanding and empathy around not only, of course, visually impaired children, but also, mental health matters?
Yeah. When it comes to mental health, I think with the community, what we are planning is to have these media engagements during this period so that we can amplify the voice of the learners with, or children, let me say, with visual impairments, because most of the times, and this also goes to the community and service providers, because most of the times when we are planning our programs, our interventions, we are thinking children in general, but these children have specific needs, and there is need for us to really bring in the aspect of empathy, understand what the children are going through, the type of mental health issues they are going through, and how now we can sit and come up with evidence-based interventions that can address the mental health issues that they go through. So using empathy, research to come up with evidence-based interventions for these children.
Just lastly, Dainus, what are your hopes for the long-term impact of this initiative, both in terms of mental health awareness and the overall well-being of, the visually impaired children?
The long-term aspirations is really for more accessible services, and we want to see more, not only UNAM going into such schools that working with such children, but also other essential service providers to realize the need to take the services to the learners, to the school. The school itself has a lot of other needs. As we know, it's one of the only schools around the country. So more accessible schools, more accessible mental health services to go. Let us go to the children.
Fantastic. Well, thank you so much for being here and speaking to us this evening.
Thank you for having me.
It was lovely having you.
Thank you.
Well, there you have it. Let's take a brief break. We're almost at the end of tonight's program, but not yet. We'll be right back.